to talk news worldwide. And quickly this morning we are looking at very important something that each and every one of us suffers, especially women. That is called ceased menstrual cycle. You are not seeing your cycle. What is the cause? And what causes it? Majorly, menstrual cycle as you have it is how God made it. That every month you must the stomach will expand. The line of the stomach have to push out the egg that are not fertilized. It's very important you know this. Now we have primary. We call it amenorrhea. Amenorrhea is a kind of a lack of menstrual cycle, lack of menstrual bleeding. Now this amenorrhea we have a secondary and primary. Primary and secondary amenorrhea. Primary amenorrhea is when a young lady at the age of 16 you're supposed to have started seeing it, but you're not seeing it. That is primary. But this one can later come up. This one can later come up in the future or in some years. Okay, so you don't have to fear. This is primary, so it's because of certain things. And this one, at that time, within some years, it will not destabilize because you might be having irregular menstrual cycle or it will not coming up. Or that. Now, the second one is what? Secondary. Secondary is a young lady within to 3 or 4 or 5 months, you are not seeing your menstrual cycle. There is a defect in it. Now, majorly the natural causes of it is what? Is pregnancy. But once you're pregnant, you won't see your cycle. Then breastfeeding and also menopause. These are natural. But aside from natural causes of it, what are the major causes? What causes that when there is a problem? You're not seeing it. One is what? Birth control. People that are taking birth control, it inhibits the line of the problem. And mind you that what triggers, let me explain it well. What triggers or makes the menstrual cycle to be effective is what? Now, there are a hormone that is called pituitary gland. Pituitary gland is hormone that releases menstrual hormones. They release estrogen and progesterone. Estrogen is one that produces the egg and the plant is and releases it into the womb. Now, progesterone is one that prepares the womb to receive the egg. Now, pituitary gland is involved. Now, what are involved? The things that are involved is what is ovary. Ovary, uterus, that is womb. Hypothalamus. Hypothalamus is the brain, the one that's cognitive, that's thinking, that makes it to happen. Then pituitary gland. Now, these are the four things that makes it to happen. Now, like I said before, first one is birth control, and the second one is stress. Stress also inhibits that. Then we also have excessive exercise. People are doing too much exercise. Too much exercise can make it not to be common. Then we also have low body weight. People that don't gain weight. Also causes. Then also another one, people that have much weight. These are also what causes it. Then we have many things that causes it. We have also malnutrition. People that don't doesn't eat well. That's if they don't eat well, it cannot trigger the hormones to release the egg. Then also eating disorder. Also one of the causes of it. Then we also have what is called polycystic ovary syndrome. Polycystic ovary syndrome is what? Is when some women, they have too much sex hormone, they have too much male hormone, too much male hormone. Now you see that this girl is a tomboy. We call it hypoandrogenemia. Hypoandrogenemia is when the sex hormone of male sex, a woman is having too much of what? Male sex hormone. Progesterone is very important. So that polycystic syndrome can inhibit it. Then we also have another one. We also have tumor, tuna syndrome. Tuna syndrome is underdeveloped egg. Underdeveloped egg that is a genetic problem, genetic issue, genetic disorder that is underdeveloped. Some eggs are not developed. Also one of causes. Then we also have genital tract defect. Genital tract defect is hymen. It's for in women's vagina. That's hymen, the one that blocks it. If that hymen is imperfected, it's too hard. If it's too hard, if the line of the stomach find it very hard to push out the blood, to push out the egg that are not fertilized to go out. So it's also one of the things that causes it. Also have premature ovarian failure. Premature ovarian failure is when you're reaching the age of 40, in fact you have not reached your menopause, but you're having some irregularities in menstrual cycle. The ovaries are not produce well, it's not going well, or maybe they are seized because of what? Because of things that happens. It's very important to know about it. Then you have also another one is a call. We have another one that is pituitary gland problems. That is, pituitary gland is the gland that's in charge of of menstrual hormones, the one that releases estrogen, all those and controls it. Now, this pituitary gland might be inhibited. It might be because of what tumor. When you have a tumor in it might make it not to be doing its function, or might have postpartum necrosis. Postpartum necrosis are the death of dead cells in that. When there's a dead cells in that pituitary gland, they cannot release the egg. Then you also have what? Also have inflammation. When it is being inflamed because of some diseases, they will also inhibit the menstrual cycle and other things. Now these are major causes of it. So if you are one of them, apart from breastfeeding, pregnancy, and the menopause, then you have to see a doctor. If it is too much, see a doctor. Then we will advise that you manage your stress. That is solution. Manage your stress. Eat well. It's very important. You eat well. Nutrition. All these calories in bomb foods. Manage what you eat. Do exercise. Just do it to a contention, not too much. That's why you don't see many women that do much exercise. It's men. So if you do much exercise, do much sport and all that, it might affect it. It's very important to know about it. Then eat well. Then relax well. Relaxation is also okay. Then eat enough fruits and vegetable. Okay, eat fruits and vegetable. Relax well. When you relax well, the brains will be now, the hypothalamus will now be very relaxed to listen with by pituitary gland to function well. It's very important. Then you can also have hormone therapy. You can meet your doctor to go for hormone therapy to increase the hormone, menstrual hormone in you, so that you're able to work well. Then you can also do surgery in case of when it is serious case. But the major thing is relaxation, eating well, then going for hormone therapy if it's much, and taking uh, 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 taking nutrition, some nutrition supplements that are also good on it. Supplements for hormones is also good to boost the hormones so that you're able to work well. It's very important to know this. Please help us to share this information. Follow us on Tok News for more information, and share this information. Follow us on Tok News. Do have a wonderful day. Thank you so much.